Craniosynostosis is a congenital defect in which one or more of the skull's sutures fuse prematurely during pregnancy. This forces the brain to expand wherever it is able, often leading to cranial and facial deformities. The condition is relatively common, with approximately 1 in 2,200 newborns being afflicted. Amongst these 1 in 2,200 is my brother Elliot, who was diagnosed with craniosynostosis in 2009. When did you first suspect that Elliot had something wrong with his head?
It was a little bit before his 2-month appointment, and I put one of those little baby hats on him, and it had a seam, and I put the seam like front to back, and it looked super weird. It made his head look weird, and then I turned it sideways, and it was better. But it was the hat really brought it out, and then we decided to ask the doctor about it at his visit.
Did you initially suspect craniosynostosis in particular, or did that revelation not come until his diagnosis?
I'm not sure that I knew exactly what it was, so I don't think that I did.
Yeah, I agree. Just we thought things were a little weird, and that was as far as we got.
What did you know about craniosynostosis prior to Elliot's diagnosis?
We learned about it in medical school. I remember getting a lecture on it where they drew a picture of like the different skulls and things like that. But it was one of like 1,000 different things that we learned about, and I don't think I really like gave it a lot of significance in just sort of the big ocean of different things we were learning about.
Yeah.
Had you ever known anyone with craniosynostosis prior?
I don't think I had.
No?
Although it's pretty common, so we probably did and just didn't realize it.
Were multiple treatment options available, or just surgery?
They told us a few different things. One was that we could not do a surgery, but the nurse practitioner that we worked with told us that she had known some kids that had had the surgery, and over time, I think they wished that they had had it because it did significantly change the way that they looked. There were two different surgical options. One was maybe a smaller surgery, but Elliot would have to wear a helmet for a period of time to help shape his skull. The second was a more serious and bigger surgery, and that's what we went with, but it was a little bit scary.
What did you learn about the condition following Elliot's diagnosis and treatment?
I don't remember specifically. I mean, I know they told us a lot about it. I read a lot about it. I talked to people on the phone whose kids had had the surgery. Certainly, I mean, we did a ton to educate ourselves, especially trying to decide which surgery to have. It was really nice to talk to somebody else who had been through it. It was very reassuring. I appreciate that mom, wherever she is.
How could craniosynostosis affect Elliot later in life, if at all?
The main thing I think is the scar that he has on his head from the big surgery. And at some point, he may choose to have that revised. He could have a second surgery, like a plastic surgery, to have it fixed, so it's not as prominent. But he wears his hair long. You know, he's gonna get long hair, so it kind of covers it up, so it becomes less of an issue. There are some types of craniosynostosis that are associated with syndromes and other problems that the kids can have, but the type that Elliot has isn't one of those.
Yeah, and it's something that you fix it and you're done. I mean, assuming the surgery goes well, there's nothing else that can happen later. It's repaired and then it's just done. There's no surgeries down the line. There's really nothing else to be done. So that's nice.
Following a lengthy surgery at just 5 months old, Elliot's condition was corrected, and aside from a scar, he is completely fine today. He turned 14 this March, is an 8th grader at Blair Middle School, and loves to play video games. When did you first learn that you had craniosynostosis as a baby?
Okay, so it would have probably been in elementary school when I first noticed that I had a scar on my head where hair wasn't growing.
How much do you know about craniosynostosis?
Okay, I know that craniosynostosis is a condition in babies where the skull joins too early, preventing the brain from growing in the correct places.
What else would you like to know about craniosynostosis?
I've never been 100% sure on how common it actually is for babies to become afflicted with it.
Do you think that many people your age have ever heard of craniosynostosis?
I seriously doubt that any of my friends or close family know much about craniosynostosis besides my parents. Let me swap it out. Swap it. Another DC.
Do any of your friends know that you had craniosynostosis?
Only a few close friends that I've told about my skull condition. It's not really a big topic of conversation.
How has your daily life been altered by craniosynostosis?
That's a good question. When I was younger, a lot of people would see my scar and confuse it for a bald spot, and then eventually they'd discover that the scar went all the way from one ear all the way to the other ear over the top of my head, so I would either have to tell them about my surgery or lie and come up with stories like shark bites or fights. And that was fun for a while, but over COVID-19, I ended up just growing my hair out to hide my scar, and so now no one can see it.
Is there anything else you'd like to say?
May I go back to bed?
Yes, you may.
And that's the whole story.